posterior arm and forearm. As you can see on this picture, in athletic individuals, you can see the outlines of the major muscle in the posterior compartment of the arm, which would be the triceps, named triceps because it has three heads. It has a lateral head, a long head, and a medial head, named so because of their orientation. During the dissection process, you will be asked to make a cut as indicated right here. You're going to cut across the anterior surface of the long head of the triceps. Best to actually insert a probe deep to it and cut on top of the probe with a scalpel as to not damage any of the underlying structures. During the dissection, note first that the teres major will cross the anterior surface. If you're looking from posteriorly, it'll be crossing deep to the long head of the triceps. The long head will actually attach slightly out of view here to the infraglenoid tubercle of the scapula. Remember, to the supraglenoid tubercle, that is where the long head of the biceps attaches. The lateral head, as we can see here, will attach to the posterior surface of the humerus lateral to this groove, which is called the radial groove, in which you will find the radial nerve and the deep artery of the arm. Then the medial head, we can't see it on this picture yet, but it'll attach to the posterior surface of the humerus medial to the radial groove. The distal attachment of all of the heads of the triceps is on the olecranon of the ulna. And the collective muscle action of the triceps is to be the chief extensor of the forearm. The long head, although, also resists dislocation of the humerus, especially important during adduction. So let's have a quick look again at the attachment sites on this image here. The attachment site of the long head, infraglenoid tubercle, lateral head, lateral to the radial groove on the posterior surface of the humerus, and the medial head, you can see it actually here, just along the posterior surface of the humerus, medial to the radial groove. Here, one more time, attachment of the long head of the triceps, attachment of the lateral head, and the medial head. And all of these three heads together will attach distally here to the olecranon process of the ulna. There's one more muscle to know in the posterior compartment of the arm, which would be the Antonius. The proximal attachment of the Antonius is here, the lateral epicondyle of the humerus, and the distal attachment is going to be the lateral surface of the olecranon and also the superior part of the posterior part of the ulna. Just like the triceps is innervated by the radial nerve, and it'll help the triceps in extending the forearm, in addition to giving some more stability to the elbow joint, and it could also abduct the ulna during pronation. Now it should be quite easy to identify the profunda brachii artery or deep artery of the arm and the radial nerve. Make sure you push a probe along here between the lateral head of the triceps and the humerus, and keep transecting the lateral head of the triceps over the probe. That'll then clearly separate the lateral and medial heads from each other. And follow the radial nerve as far as you can toward the cubital fossa. Have a look at this nice little cross-section here from your dissector, and recall that all of the muscles in the anterior compartment of the arm are going to be innervated by the musculocutaneous nerve. Now we're working on the posterior compartment though, and everything here is going to be innervated by the radial nerve. The median and ulnar nerves do not innervate anything in the arm. That comes later, for instance in the forearm and the hand. With a little bit of luck, your dissection might look something like this. Note first the position and the relative orientation of the teres major to the long head of the triceps. See, here is your radial nerve and the profunda brachii artery traveling together. Down here is the medial head of the triceps. Here's the brachial artery, and here's the collective tendon of the triceps attaching to the olecranon process of the ulna. Now we're moving a little further distally into the forearm. The posterior compartment of the forearm contains all the extensor muscles of the hand and the digits. The good thing about this is we can divide it into a superficial and a deep layer of muscles. The muscles of the superficial layer will be the ones that extend the wrist and the proximal phalanges. The muscles of the deep layer will cause supination of the hand, extension of the index finger, and abduction and extension of the thumb. As with the muscles of the arm, everything here is innervated by the radial nerve. Specifically, actually, here it's a deep branch of the radial nerve for the extensor muscles of the forearm. Also, the nerves and vessels in the forearm will be running in a connective tissue plane that'll divide the superficial layer of extensors from the deep layer. As you're using blunt dissection to remove the remnants of the superficial fascia of the posterior forearm and the dorsum of the hand, make sure you try and preserve a little bit of the dorsal venous arch. And make sure you positively identify this structure, which is your extensor retinaculum, which is basically a specialized antebrachial fascia located right here on the distal forearm. You will find a total of 6 muscles in the superficial layer of extensors: the brachioradialis, the extensor carpi radialis longus, the extensor carpi radialis brevis, the extensor digitorum, extensor digiti minimi, and extensor carpi ulnaris. All the ones labeled with a star actually attach to the lateral epicondyle of the humerus by way of a common extensor tendon. Also, please note that down here in the dorsum of the hand, the tendons of the extensor digitorum muscle are actually tied together by little intertendinous connections on the posterior surface of the hand. In this cadaveric dissection, you can already identify some of the muscles. Here's the extensor carpi radialis longus, brachioradialis, extensor carpi radialis brevis, extensor digitorum, extensor digiti minimi, extensor carpi ulnaris, and some vascular structures, for instance the dorsal venous arch, the basilic vein, the cephalic vein, and quite importantly here, the superficial branch of the radial nerve, moving its way all the way up to the dorsum of the hand here. Have a look at this image of an extensor expansion on the 3rd digit, which as you can see is wrapped around the dorsum and the sides of the proximal phalanx and also the distal end of the metacarpal bone. It's kind of shaped like a hood, and its function is to retain the extensor tendon in the midline of the digit so that they stay nice and centered. Also, you can see here that tendons of the lumbricals and interosseous muscles attach to the extensor expansion. All of the extensor tendons are going to be contained within individual osteofibrous tunnels that are lined by synovial sheaths. Moving on to the deep layer of extensors, we have 5 muscles: the supinator, abductor pollicis longus, extensor pollicis brevis, extensor pollicis longus, which you can recognize because it has a much longer tendon here, and the extensor of the index finger, extensor indicis. In the cadaveric dissection, this is what it looks like: the supinator, abductor pollicis longus, extensor pollicis longus, extensor pollicis brevis, and extensor indicis. The proximal attachments of 4 of the muscles of the deep layer of extensors, which would be the abductor pollicis longus, extensor pollicis brevis, extensor pollicis longus, and extensor indicis, are the posterior surfaces of the radius, the ulna, and the interosseous membrane. 3 of these muscles, or actually their tendons, emerge from an interval between the extensor digitorum and the extensor carpi radialis brevis muscle. So in between here, extensor carpi radialis brevis and extensor digitorum, which is also the reason why these are often referred to as the outcropping muscles of the thumb. The abductor pollicis longus attaches to the base of the first metacarpal bone. Extensor pollicis brevis attaches to the base of the proximal phalanx of the first digit. Extensor pollicis longus attaches to the base of the distal phalanx of the first digit. And extensor indicis will attach to the extensor expansion of the second digit. Identify this little depression on the posterior surface of the wrist. It is called the anatomical snuff box, and it will be bounded anteriorly by the abductor pollicis longus tendon and the extensor pollicis brevis tendon. The posterior boundary of the snuff box is the extensor pollicis longus tendon. If you look inside it, you can find the radial artery, which you can then follow until it disappears between the 2 heads of the first dorsal interosseous muscle. The dorsal carpal arterial arch receives a branch off of the radial artery that arises within the anatomical snuff box right here. Here's a review of the proximal and distal attachments of the muscles of the posterior compartments of the forearm. The brachioradialis attaches proximally to the 2/3 of the supraepicondylar ridge of the humerus, and then distally to the lateral surface of the distal radius. Extensor carpi radialis longus attaches to the supraepicondylar ridge of the humerus proximally, and then distally to the base of the second metacarpal. Extensor carpi radialis brevis, extensor digitorum, and extensor digiti minimi proximally all attach on the lateral epicondyle of the humerus at the so-called common extensor origin. Distally, extensor carpi radialis brevis attaches at the base of the 3rd metacarpal. Extensor digitorum distally attaches to the extensor expansions of the medial 4 digits, and extensor digiti minimi distally attaches to the extensor expansion of the 5th digit. Extensor carpi ulnaris comes from the lateral epicondyle of the humerus and the posterior border of the ulna via a shared aponeuroses, and then distally attaches down here on the dorsal aspect of the base of the fifth metacarpal. In the deep layer, the supinator will proximally attach on the lateral epicondyle of the humerus, the radial collateral and annular ligaments, the supinator fossa, and the crest of the ulna, and distally it'll attach lateral, posterior, and anterior on the surfaces of the proximal third of the radius. Abductor pollicis longus comes from the posterior surface of the proximal halves of the ulna, radius, and interosseous membrane, and distally attaches to the base of the first metacarpal. Extensor pollicis brevis, this muscle, proximally attaches to the posterior surface of the distal third of the radius and the interosseous membrane, and then distally attaches down here to the base of the proximal phalanx of digit number 1. Extensor pollicis longus proximally attaches on the posterior surface of the middle third of the ulna and the interosseous membrane, and distally attaches to the base of the distal phalanx of the first digit, so the thumb. And last but not least, extensor indicis attaches here on the posterior surface of the distal third of the ulna and also a little bit to the interosseous membrane, and distally it'll blend with the extensor expansion of the second digit. And it's time for Blitz Anatomy. The arm, triceps, long head, lateral head, medial head, profunda brachii artery, profunda brachii vein, radial nerve, and again medial head of triceps. Dorsum of the left forearm, extensor carpi ulnaris, extensor digiti minimi, extensor digitorum, extensor indicis, extensor pollicis longus, extensor retinaculum, Antonius muscle, flexor digitorum profundus, flexor carpi ulnaris, extensor digiti minimi, extensor pollicis longus, extensor carpi radialis brevis, abductor pollicis longus, extensor pollicis brevis, the superficial branch of the radial nerve, extensor retinaculum, extensor carpi radialis longus, brachioradialis, supinator muscle, posterior interosseous nerve, abductor pollicis longus, extensor pollicis brevis, extensor pollicis longus, extensor indicis, interosseous membrane.